Welcome back, Dr. Mulholland in Washington, D.C. Our four-step non-excisional facelift, injectable RF internal, which is the quantum, external, which is the RF, followed by toxin, filler, and now suture suspension elevation. We're doing what's essentially called a grilled cheese lift. RF liquefies the cheese, we slide the bread, and the cheese then congeals. It's collagen that holds our lifts up, be it excisional or non-excisional, and this is how we elevate the now RF undermined flap. And so we have our patient already. Zoom in. We've done our RF quantum along the jawline, submentum, nasolabial fold, and up and down the cheek and face with the Morpheus. Now we want to do that. We want to lift and elevate that to a higher position, which is an advancement flap of undermined tissue, which is in essence a facelift, and hold it while it's healing like we would a facelift. Now zoom into about here if we can. Perfect. Now, that's good. Now tilt down, and I'm going to show you the construct. This is our construct. This is $75 a suture. It's made in New York State by PDO Max. I designed the suture with them. I showed them what I would do if I was making the perfect construct for a non-knotted, no knot needed, highly tensile loaded, strong, absorbable, affordable suture. And so you open up your pack, use one on each side. Each limb is 41 centimeters long. You already have a Keith needle loaded on each arm, so you can pass it without using a spinal cannula. The central part of a bidirectional always has no barbs, and so the central part loaded right here is barbless, and that's important. I'll show you why. And now one limb on each side is 41 centimeters long from the unbarbed to the Keith needle. I'm gonna hand that off to Shelby. I take the other limb out. This limb is also 21 centimeters in length from the Keith needle down to the unbarbed central segment. Hang on to that limb. Zoom out a bit, Quan. You can see Shelby's hands and this. Perfect. All the cogs are pointing back to the uncog segment. So this is going in this direction, these cogs are going in that direction. Each cog is like a quill on a porcupine. They dig in and they don't let go. These will reduce stress relaxation and viscoelastic flow to hold the lift. The uncog segment, which is about 2 to 3 centimeters in length, at the very end here, acts as the loop upon which the lift is predicated. So this is a bidirectional, dual-armed, Keith needle-loaded, cogged 2-0 polydiaxonone, PDO. PDOs dissolve over time. About 50% of the tensile load strength is gone in about 3 or 4 weeks, about 80% in 6 weeks, and then it's gone completely by 24 weeks. All you're using this is to hold up your undermined tissue while it heals with collagen. So let's zoom in here, and we've got one limb. One limb, if you show the temporal area here, is going to go anteriorly. One limb is going to go posteriorly, and we're going to form a V. The base of that V is going to be a loop that's going to lift the face up. It's going to do that. So hold on to both limbs. We use a little mesotherapy lidocaine, and we inject each limb. One limb posteriorly, one limb anteriorly. So one limb is going to go behind the hairline here. One limb is going to go along the hairline. We're going to come out in that temporal tuft, and we're going to inject a little bit in front of the hairline above the ear for any dog ears. And that's it. Simple mesotherapy lidocaine. And so I take limb number 1 on my Keith needle. This 21 centimeter PDO has all the cogs pointing down. I find my access port for the best lift for this young lady, where I capture the SMAS. Capture the SMAS. Give me that back. Give me the gauze back. Give me the gauze back. Thank you. And so I'm going to find my lift point. I'm going to go through my lift point in the temporal tuft skin, where there's temporal hair. I go through, I grab the SMAS, Then I come superficially just behind the hairline, go up about 2/3 of my Keith needle. I come through the scalp. I can see the end of my needle right here, and I pull this out without poking Shelby in the eye. And I pull out, tilt your camera up a bit. There we go. And I come out and I pull until the loop comes up almost to the skin. So zoom in right here. There we have our non-barbed segment right there at the temporal tuft. Now, I'm going to take that unbarbed segment, leave it looped. I take my second limb. There's my posterior limb. Typically, I used to go through a little slit so I bury the non-barbed segment. Now I leave about a 5mm bridge so it doesn't cheese wire. I pop through the skin again. I grab some of that SMAS, no dangerous structures there. And I'm gonna come off now my loop. I'm gonna pass my posterior Keith needle back behind the ear, up into the hair, about 2/3 of the way along my Keith needle. Provide some counter traction, pierce through the scalp, grab the tip, pull it out, and now I've got both limbs suspended, and I've got my non-barbed segment right here.